The Oklahoma Foundation for Medical Quality is a nonprofit founded back in 1972. Its mission is to basically improve healthcare and improve lives.
Our work in the Regional Extension Center grant focuses on finding providers across the state and preparing them for health information technology. That preparation begins with an electronic health record selection and adoption process, continues with an electronic health record implementation, and ultimately moves that provider into what's termed meaningful use.
Oklahoma is disadvantaged because of our rural area, and there is a lot of medically underserved. Some of the areas we go to, it's a 5-hour drive one way, and there may only be one doctor in a 60-mile radius.
Purcell Family Practice is a practice in rural Oklahoma, and I worked with Dr. Dye there. And when I recruited them and we started working with them, they were on paper charts.
I had stacks of charts all over the office. And one of her first things she told me is that we're going to get rid of these stacks. And I looked at her and said, okay, sure. It was incredible what she did. She embraced the practice. She went through each individual workstation. She was able to see my workflow and help us and assist us.
My goal is to help people get to meaningful use. That's their ultimate goal, so my goal is to begin with the end in mind.
OFMQ's process is unique in that we're vendor neutral. We don't reach out and try to sell the provider anything. No software, no hardware. Our services are there to help that provider feel empowered and advocated to move forward in health information technology, whatever process that might be.
I think the benefit to electronic medical records from going to where we had paper is just the record keeping part of it. The accurateness of your of the medication lists, of referral letters. We've caught errors, we've prevented probably some significant medication reactions with patients because of it.
Cleveland Area Hospital was another great facility that I had the chance to work with.
Our hospital is located in Cleveland, Oklahoma in Pawnee County. We're a 14-bed critical access hospital. We have a surgical department, full lab and diagnostic services, physical therapy, senior life services. We're the only hospital in the county.
And a hospital is a whole different ballgame than a clinic. Similar, but a lot more pieces of the puzzle to put together.
We were a completely paper facility. We didn't even have a computer at our nurses station. We had no email for our staff. What I found so helpful with Lindsay and OFMQ was they knew most of the products. They knew the stumbling blocks. They had been involved with other facilities who were using our vendor specifically, and they could tell us where the reports lived and where the meaningful use information lived, where the quality reports lived. That made us able to achieve meaningful use at a quicker rate because she had already had so much experience with CPSI.
Oklahoma providers really are unique in that they develop that trusted advisor relationship with our team when we're there on site with them. They're not interested in another WebEx or another email or another blast of faxes telling them what they need to do. They want to be able to shake a hand, they want to be able to make eye contact, they want to be able to really reach out and feel that they can trust someone.
They were here at every level. They came to our staff meetings, they came to our privacy and security meetings. We all pushed the button on the mouse together. It was at every aspect of our transition.
Privacy and security is extremely important. We want to treat our patients with, utmost respect and privacy when they are in our facility.
We can scan the bracelets now and scan the medication, so you're never giving anyone something that doesn't belong to them. We have the patient's photo electronically scanned into our system, so you can do a second patient identifier, so there's a safety feature there. We can transfer information to their primary care offices, so there's a good continuation of care, which helps everyone to communicate better.
We have reached 1,000 doctors that we're working with. I'm pleased to say over 800 have adopted and implemented an electronic medical record, and a little bit over 200 have already achieved meaningful use.
I think it's important to stress that OFMQ is unique as a regional extension center because we're also a quality improvement organization. We're able to synergize and collaborate with our QIO here in the state because we are the QIO here in the state. That gives us a great deal of leverage as far as having individuals who are qualified and skilled.
OFMQ will be one of the main reasons that we will have that higher care, because we're committed to making a difference. We're here, we're vested,